Yes, excellent. Yes.
Uh, is it visible now?
Yes, ma'am.
Yes, ma'am. It is visible. We are seeing it. It's visible now.
Okay. Hello, everyone. Today I'm presenting my presentation on diabetes. So, on diabetes, World Diabetes Day, I'm presenting my. Actually, I'm not getting that much time to create PPT, but I'm trying my best to do. So, first, I'm giving introduction. Hello.
Yes, ma'am. We are hearing you. We are hearing you.
Okay.
You may continue.
So, first we have to know what is diabetes. Diabetes is a metabolic disorder. It is due to absolute or relative deficiency of insulin. In our blood, if deficiency of insulin occurs, then the person suffering from diabetes. That is, there are three stages in diabetes. One is normal, up to 100. If your blood sugar fasting is up to 100, then it's normal. If it's uh, more than that, but not diabetic level, that is called pre-diabetic state. A pre-diabetic state is just like a silent, no symptoms, no other. You can't suffer from any disease, but inside it's growing and damaging your systems. So pre-diabetic stage is a silent killer, and usually how to diagnose that? So for that, if you measure your diabetes blood sugar, then it's up to more than 100 in fasting, and after 10, 12 hours of fasting, it will be more than 100 and not more than 150. So you can again whenever you measure it, you feel that you are in a pre-diabetic state. So it's more hazardous than diabetic, because if we are aware about diabetes, then we can cure. If we are not aware about something, then it's damaging our system. So three stages: normal, pre-diabetic, and diabetic. So after test, we can diagnose this. So in Ayurveda, diabetes is defined in three ways: Vata, Pitta, Kapha. So in Kapha, having 10 types, Pitta they have uh, explained 6 types, and Vata 4 types. So in 4 types, Sarpi, Vasa, Hasti, Madhume. So Madhume is nowadays known as diabetes mellitus. So in Ayurveda, they are saying if you are suffering from something like as a any disease, or they are distinguished it in Vata, Pitta, Kapha. So Vata type of the Madhume, that is Madhume, is nowadays known as diabetes mellitus. So in diagnosis, how we know that he or she is suffering from diabetes. So, if we are doing blood sugar fasting, then it's above 125. And again, we are doing good. Maybe sometime we have taken some sweets or another things, so it may be more than 125. But 1, 2, 3 times you have done, then it's always above 125. Then you have to be aware about that. If you that means you are about to borderline or suffering from diabetes. Or you can do blood sugar random and HbA1c also. That is also, if above than 6.5, then you must be aware about that. So diabetes mainly is of two types. One is type 1 diabetes, and second is type 2 diabetes. Type 1 diabetes usually inherited from parents, and usually is by like a autoimmune condition. Our pancreas is not producing that much insulin to survive like in a normal position. So person is suffering from diabetes. And in that situation, you have to take insulin. It's necessary to take insulin. And it's a autoimmune disease. It's like the autoimmune system, you're damaging your autoimmune system. And second is type 2 diabetes. That is not a main diabetes. but it's also hazardous. But in younger age, you can't diagnose this. This is also inherited from parents, but not like as inheritance is because of the lifestyle. In this situation, the patient is not insulin deficient, but it's insulin resistance. It's creating insulin resistance, so he or she has to change his lifestyle. And another is a condition that is gestational diabetes. That is not the diabetes, but during pregnancy, pancreas disturb its hormonal balance or something new, different. Some hormones are different and creating diabetic situation. So that is gestational year during pregnancy. Some ladies are diagnosed as diabetic, but after delivery they are become normal. So in the 24th week, 27 weeks, they are diagnosed as diabetic. But after delivery they become normal. That was because only of the situation of pregnancy. So usually from where we are getting this diabetes? So diabetes usually type 1 is we are getting from parents or inheritance, and second one is from dietary source, or dietary sources from we are getting blood high of our blood sugar level. Second one is how our blood sugar level, another reason why it increases. It increases due to non-carbohydrate sources, which fat sources or protein sources, which changes our blood sugar, our fat or protein into the sugar. Or another source of blood sugar is glycogenolysis, means glycogen break down into glucose. That is also increase our blood sugar level. So in by these three, blood sugar level enhance or increase due to these three. If it happen again and again, then it will create a diabetic situation. So these are maybe due to some hormonal reasons. Why it's happening again, sugar level high. So it may be due to some hormones. So some hormones like as insulin, glucagon, epinephrine, thyroxine, glucocorticoids, these hormones are stabilizing glucose level in our body. If they are disturbed, then again and again blood glucose level is disturbed, and then glucose level is disturbed. It increases in our blood and in a sugar form, and it's coming by urine or other sources, then it's like a situation of diabetes. Some hormones also enhance this situation, like as growth hormones, cortisols, estrogens, progesterones, and placental. I have already discussed that, like as in pregnancy, they are also affecting diabetic situation. So other main how we can diagnose it, so that he or she is suffering from diabetes. So by some without test, by those symptoms or by signs, how we diagnose this. So three main situations by we can assess by the patient. If someone is coming saying, "I'm doing again urine in the especially in night." At daytime, maybe someone have drank some juices or other drinks. So one or two times, three times, well, any time, like as a in a week or in a month, maybe urine frequency may be increased. But if someone is suffering from diabetes, that person will go for urination in the night 2, 3, 4 times, 5 times, maybe more. So that is the situation, polyuria, increased urination. And that is increased due to renal threshold. If it's increased more than 180 mg per dl, then that patient is suffering polyuria. Then polyphagia, means excessive eating. Person is feeling like that I'm hungry because the glucose level of the cell intake that decrease. That decrease, so cell is feeling like hungry and is giving stimulation to the brain that I'm hungry, you have to eat. I am hungry, you have to eat. So in that situation, person will eat. So in type 1 diabetes, he or she may lose weight. But in polyphagia, that person will increase weight. And after some people person are eating, then also they are losing their weight. Then another situation is polydipsia, means excessive thrust. Again and again, he or she is taking water, drinking water. Then they saying, "I'm feeling some dryness in my throat." So that is the again situation polydipsia. Because of polydipsia happen because you again and again because of again and again urination, sugar level is going down, and in the blood it's also having sugar, but by urine it's passing sugar. So level of blood, water level in blood, that also decrease. So because of that, person is feeling excessive thirst again in the night also. Those who are not drinking water in the night after diabetes, they are again feeling that I'm thirsty. So three main cardinal signs are polyuria, polyphagia, and polydipsia. And another signs may be weight loss, fatigue, without any reason, without doing any work. Diabetic person will feel that I can't do work. I'm feeling low. So that is the another cardinal signs. Some complications are also there. Hypoglycemic situation, because cells are not getting that much sufficient glucose. So in that situation, hypoglycemia is the situation. And if we are giving insulin to someone, that time also it consumes uh, sugar of the body, and insulin is proper not working. Then in children, if less than 30 mg per dl, and in adults it's less than 60 mg per dl, then it means they are hypoglycemic. Another complication with due to diabetes, ketone bodies are increased in the body. Mainly in type 1 diabetes, if it's 250 mg per dl, then it's the situation of diabetic ketoacidosis. Then third situation is also third complication is also in diabetes, that is hyperglycemic hyperosmolar state, that is HHS or HHNKS. In this situation, blood sugar increasing rapidly, and maybe more than 600 mg per dl, 700, 800. So that is life threatening. In that situation, you have to instant go to ICU or to the doctor, contact the doctor, because this is SH and KS is the most life threatening situation, and it's usually happening in the type 2 diabetes. So, and another test you can confirm by this high level of blood urea, creatinine level. So, all these levels are become high. So, by you can diagnosis this is suffering from HHNPS. Other consequences are due to the diabetes. Why people are more aware about diabetes? Why world is celebrating World Diabetes Day? Because not diabetes affecting our blood sugar level, that is affecting every organ. Eyes, nephrons means kidneys, nervous system. So due to eyes are like some cataract occurring in the eyes, and that is like in the eyes pattern cataract. And other opacities in a similar way, where retinopathy is happening in diabetes. It's like as ice granules or ice crystals like. So it's due to the accumulation of sorbitol in the retina, and is usually called as less curable or non-curable. Another situation, neuropathy. Nerves are damaged by this. Nephropathy, chronic kidney disorder. In this, neurons are damaged. Hypertension may be occurred. And heart disease are occurred. Another, oxidative distress, immunosuppression. And because of that, the person is suffering from some infection or it's not curing in a simple terms. If some wound has happened, then it takes 2, 3, 5 days to heal. But in a diabetic person, it takes months, it takes sometimes years to heal. And maybe sometimes it's not healing. So you have to do amputation. And this is the main complication here in diabetes. patients we have seen, they have been cut toes or leg or some due to some gangrene. So it's also uh, affecting our immune system. And cancer is also happening due to diabetes and gastroparesis. Some muscles are paralyzed or doing acting like a in a different way. So that is also happened due to diabetes. Biliary disorder also, and the memory issues also happen due to diabetes. So sometimes more consequences, more other organs are affected by the diabetes. So, how we diagnose? We can diagnose it by blood sugar fasting, blood sugar postprandial, blood sugar random, and HbA1c, albuminuria, and lipid profile. Some other tests we have to go through what you can do, like a lipid profile, LFT, KFT. That is also to diagnose if it has been affecting liver. It's also affecting kidney. So some tests also we can do for that. Some after that nowadays everything is evolving. So a monitoring devices came into the market, that is freestyle libre, because every prick creating pain in the patient. So every time he or she is doing the BSR or blood sugar fasting, random, anything that he or she is doing, then every time you have to prick from once a day, twice a day, thrice a day, four times a day. So it's always hurting. So some devices are in market. It's a freestyle libre that is inserted under the skin, 5 deep is under the skin, and is giving reading in seconds. In every 15 minutes, it's giving reading by itself. So uh, in 14 day, you have to remove it and again to attach another patch of it. So if a patient will be um, patient will be free of pain for 14 days at least. Not every time he or she must to take. So it's another diagnosis tool is there. Then the treatment is we are discussing about the treatment. So what we can do? We cannot do that much in diabetic case. Like as cancer, you can do surgery or chemotherapy or other things. Like a surgery, some issues are creating an accident, so you have to bandage or anything. But in diabetes, the main thing is you have to do proper diet. And diet must be fibrous diet, low glycemic index diet. Food must contain fiber, protein, diet must be there, and citrus fruits are more useful than other sweet fruits. And in Ayurveda, six rus they have uh, defined six rus, but you have to mainly prefer tikta rus, not madhur. And another thing like as curcumin, uh, is also known as haldi or hardra, Trafalgar, that is Harad, Baheda, Amla. So these are really useful. Vijay is also very useful. You have to take a Vijay glass and put some water in whole night, then use it in the morning. Again, you have to pour another water in the morning and in the evening you have to drink. So Vijay glasses are available in the market. You can take them and use them. Bitter gourd like a Karela, Methi, and Neem, all mainly bitter things are very useful in the treatment of diabetes. Hypoglycemic drugs, many drugs are there in the market, but here we are mainly discussing natural things. So we are not discussing like metformin, sulfonylureas, or other allopathic drugs. But in Ayurveda, that is CSIR developed a drug that is BZR32 and it's really very effective. It's changing pro-insulin to insulin, and many researches are going on it. Many pharmacovigilance research and projects are going on BZR34, and results are also published of it in the publications. So it's in now patent drug BZR34. And to avoid diabetes, or to become aware, you have to do regular checkups. You have to control weight and also diet and lifestyle changes also must be there. And what to avoid? Avoid, you have to avoid like as those things which are having high sugar level. So sugar cane and sugar, every type of sugar and sugar cane, the sugar cane products also you have to avoid. Dates which are having a sugar content or glucose level high in that is dates, banana, grapes, coconut water, fruit juices, rice. Like all these things are increasing carbohydrates, glucose in the body, potatoes also. And due to increase in glucose, they are disturbing diabetes or sugar level, insulin level. So you have to avoid all these things. Some people are using like as a daily they are eating rice. So how they can avoid that? So in the morning they can use rice or potato. In evening they have to use other things like as ragi, bajra, millets, other things they can use. So those who are daily using rice, they can skip a meal of the evening and try other things. But in morning, because they are rice eating people, so every time they can't change. So some modifications they can do, but fully they can't avoid rice. Some exercises and I have written here walk. Why they have written walk? Because the best therapy of the diabetes is walk. So some exercise we can do Mandukasan, Vajrasan, Paschimottanasana, Kapalbhati, Bhujangasana. Some we can do, and they are really effective. So on daily basis we can do some yoga, Mandukasan, Vajrasan. After eating food, we can sit in the Vajrasan position without eating food. And in the morning, Paschimottanasana, and morning Kapalbhati and Bhujangasana we can also do. So in regular basis we are doing that is also lowering our hormonal imbalance. And if we are in a good state, in a hormone balance situation, then we are not suffering for diabetes or we can cure ourselves. And walk is must. They have said you can't, those who are suffering for diabetes or not from suffering diabetes, they also walk. But especially those who are suffering from diabetes, they have to walk every day they have to walk. And there is a story also, there is a sage who said, a person went to him and said, I am suffering from diabetes, I need some medicine. He was a famous sage. Rishi Muni, they are in ancient time, they are treating. So he said, tomorrow morning you have to come and then I will give you medicine. Then morning he came, he went and he took hours to go there. Then he gave him a dose. Then he said, tomorrow you come. Like this, we have done 4 months. Then the man asked, why you have done this with me? Then he said, because you are suffering from diabetes, and diabetes is not treated only by medicine. Medicine is secondary. You have to walk. So I'm asking you to come here daily. If I have given you all these things at a time, then you will never come to me again and you will not walk at home. So I am doing walk therapy for you. So, in natural ways, walk therapy or other therapies which are feasible or which are useful, they can also uh, that person can do. So, this is I think sufficient for today. Thank you, everyone.